Today, I'm here to announce that the first presumptive case of COVID-19 has been detected in Alberta.
It's a moment few Albertans will forget. 5 years ago today, Dr. Dina Hinshaw took to the podium to announce COVID-19 had arrived in the province. Since then, nearly 6,700 Albertans have died due to the illness.
This is not a disease that's come and gone. It's unfortunately something that has left its mark on Alberta.
The U of C's Craig Jenny has been watching from the start.
The pandemic has ended, but unfortunately the endemic stage has now begun, and that's a virus we're going to have to deal with basically every year moving forward.
Deaths and severe illness are undoubtedly down, but hundreds of Albertans are still dying of COVID each year, far more than influenza. And while many expected it would eventually become a seasonal virus similar to the flu, that hasn't truly happened.
We're not seeing it go away in the summer. So it goes through these little undulations as new variants evolve, and we see a little uptick, but then people's immunity builds and it goes down again. And that's happening year after year.
And the pandemic has left another mark.
In our desire to move on and get past it, I think we're forgetting some of the people that have been wounded by it.
This Calgary cardiologist treats many long COVID patients. He estimates 5 to 10% of Albertans have ongoing symptoms after a COVID infection, and up to 2% are so debilitated they can't work.
And we're not necessarily, showing a commitment to providing the resources to help them continue to be a part of society.
AHS shut down its multidisciplinary long COVID program last year. Raj says that means care is less coordinated and accessing the right specialized care is more difficult. Jennifer Lee, CBC News, Calgary.